This is the brief on how incidental adrenal tumors and their cortisol levels affect your long-term heart health. Doctors sometimes find a benign tumor on your adrenal gland, called an incidentaloma, that slightly overproduces the stress hormone cortisol, a condition known as MAX. A massive European study tracking over 2,500 patients investigated this. But if we find this benign tumor by accident, do we really need to worry? Or is the medical anxiety worse than the disease? First, one hormone test isn't enough. In fact, over 22% of patients had their diagnosis change within 3 years. Think of that cortisol test as a blurry video rather than a high-resolution photograph. One snapshot simply doesn't capture the moving target of your hormone levels. Second, the blood pressure threat is real. Patients consistently testing positive for MAX saw high blood pressure worsen faster than those with normal tumors, hitting that threshold in 60 months instead of 86. Since their blood pressure is worsening so much faster, doesn't that mean these tumors are a ticking time bomb for fatal heart attacks? Finally, the mortality reality check. Despite those blood pressure issues, once researchers adjusted for age and pre-existing risks, the high cortisol didn't independently cause a spike in death or major blood clots. Age and baseline health are still in the driver's seat. The extra cortisol is just an annoying backseat driver that raises blood pressure but doesn't crash the car. Ultimately, if you have a mildly active adrenal tumor, keep a very close eye on your blood pressure, but you don't need to panic about the cortisol independently triggering a major heart event.